Thank you for talking to us today about the Macmillan Primary Care Cancer Framework Programme. Could you please tell me about the opportunities for education and sharing best practice?
A big part of my job is education, so I personally am involved in organising teaching sessions within my health board usually, and we also do some cross-health board teaching as well. The most recent one we've been doing is a series of webinars. Obviously with COVID-19 we can't go into practices and teach face-to-face at the moment, so we came up with the idea of having remote teaching sessions. So I contacted the consultants who are leads for each cancer specialty in my area and asked them if they would come and speak in lunchtime sessions to GPs and practice nurses, anyone who's interested really.
Our education workshops are attended by a host of primary care professionals. So we've had GPs, practice nurses, nurse practitioners, paramedics, pharmacists, and learning together, I think, is a key factor of sharing our knowledge and reflecting on our work as well.
Cancer peer review is done of secondary care teams, and one of the questions we would always ask would be, how do you engage with primary care colleagues? We turned that around and had primary care attending those events to understand what the issues were in terms of accessing advice or diagnostic tests, or ultimately the communication between primary and secondary care as patients go through the pathway. It was fantastic to have a primary care presence in peer review.
What's been good about this programme is not only have we worked on developing education, support and resources for primary care professionals to increase their knowledge, to increase their confidence. What most of those interventions have been based on is asking the primary care professionals, what do you need?
It's very important that everybody is trained up and is aware of the signs and symptoms of cancer, and that's from the receptionists, from the admin staff, practice nurses, pharmacists, etc.
Pharmacists are accessible, and we're more accessible than we've ever been. The pharmacist is seeing that patient month on month on month on month. They will know that patient by name, they will know them by sight. You can watch their health change and you can think something's not right here.
The pharmacy study day was especially helpful for the community pharmacists, many of whom have never worked directly with cancer. They may not have worked in a hospital. It was about bringing them up to date, talking about symptoms and signs. Of course, patients attend community pharmacies with symptoms, and for the most part, the pharmacists are well educated about which ones are red flags or what to look out for, but it's always good to have an update, and I think they found it really, really helpful to talk through that information, and especially things that have changed perhaps since they've been training, the different investigations we do now and what we look out for.
So before COVID, we had some training that was obviously face-to-face, but I think what's really shines with this community of practices, we've adapted through COVID. So now we've just literally finished online training, and I've been receiving all the feedback, and it's just been amazing. It's been a massive success. The team are so good at adapting that if they see that there's a need or a gap that comes up in a training, they'll adapt the course so that the next course or the next session will cover what may be missing in the first one.
So as a team, we pulled together an education module, a virtual education module, working online. And already we can see the difference, the impact of our training. We already hear from our colleagues of nurses and doctors how they are changing their practice, how they are now supporting cancer patients during COVID by picking up the phone and asking them what their issues are and how they can be supported during this very difficult time.
I learnt so much from my colleagues, and having that community of practice, having those colleagues working with me from across Wales actually enhanced my skills and my ability and my effectiveness. So what we've had is a programme that has developed people enhance their skills and experience, and improve that pool of talent and leadership within primary care. So the potential for that is immense.
It's been wonderful to be involved in the Macmillan Primary Care Cancer Framework Programme, because I've seen the journey we've taken from the beginning to now. I've seen how the team has developed, all the wonderful initiatives, projects, training that has come out of this programme that will have a long-term positive impact on cancer patients in Wales, and we work really well together.